So here we are going to discuss about the role of an RN. So as an RN, what we should do? First of all, assessment the patient or client, determine the plan of care for your patient, also care for the most critical and unstable client. For example, the fresh post-operative client. So after surgical operation, you are the person who go for the assessment, and also client with a change the condition who need the assessment. Imagine a patient whose vital sign is fluctuating, vital sign is not stable. We will change. We need to assessment, and the RN supposed to do this. RN always be there when patient take admission, when patient need discharge from hospital, and also transfer from one unit to other unit. Like a patient has pulmonary TB and patient need to stay for long time in the hospital, patient need to transfer rehab center, or patient need to transfer hospice center who have a cancer, right? Terminal disease. So always aren't supposed to there. Assess available staff and their job description. Perform the most complex procedure. For example, starting IV or interpret the electrocardiogram or EKG or ECG, also correlating the lab values. The collaborate with the other department and discipline. It might be interdisciplinary approach when you talk with the other department in same hospital, or direct supervision the LPN or other accessory staffs. So also we have a CNA or the like LPN, RA, I mean new graduate, all supposed to work under RN. Also act as a client advocacy if they need any kind of help to make a decision. So you can do this. So what is the role of LPN? So LPN provide the care the client in stable condition. So who's stable? The patient whose vital sign is not fluctuate, right? Or under this, or LPN can work under the supervision of RN and other healthcare provider, perform the basic therapeutic or preventative care and rehabilitative procedure. For example, the sterile dressing change, urethral catheter and tube insertion, application of restraint. Also, assist RN with unstable and complex client. Although there are variations among the state, LPN are usually not allowed to do what? LPN are not allowed to perform triage, means you have a 4 patient who will go for the priority, who are assessment them, right? Also, yet LPN are not allowed to admit IV chemotherapy, perform central line procedure, or administer blood transfusion unless they have satisfactorily completed a transfusion training program and meeting the criteria, especially by the Department of Health and State Education Department, right? A RN must be present for supervision if LPN go for blood transfusion. Then what is the role of CNA, right? It is also called UAP. So CNA provide the routine job, non-skilled care such as bed making, bed bath, Also routine vital sign monitoring, or if patient need any kind of enema or pharyngeal suctioning, right? CNA is supposed to do this. So here I'm going to explain the different type of leadership and professional issues. There are three types of leadership in nursing science. One is called laissez-faire, autocratic, and democratic. So first of all, laissez-faire means offer the little, if any, guidance. So team leader do this. So laissez-faire leadership, also known as delegative leadership. It is a type of leadership style in which the leader allows the group members to make the decision, right? So we found that this is generally the leadership style that leads to the lowest productivity among the group members. So each and every group member can participate to make a decision, or leader can choose the best decision. Next one is called autocratic leadership. It is a bit restrictive. So autocratic leadership, or this kind of leadership, takes a little input from the other member and try to control every decision of the organization. So team leader or team nurse can take the decision. This type of leadership is better for making the first decision, and when it requires the error-free outcome. Let me recap it. Autocratic leadership is a type of leadership that is characterized by decision making without input of your team members. In an autocratic leadership style, the leader makes all of the decision without any consultation or input from the rest of the team members. The next one is called democratic, means consult with the staffs. Democratic leadership style, also known as participating style, means everybody can participate. It is encourage the staffs to be a part of the decision making, right? And democratic leadership keeps the staff informed about everything that affects their work, and also share the decision making and problem solving responsibilities. So consult with the staff. So like we have a team and team leader is a RN, she can discuss with every members. Next one is professional issues. So first one is a chain of commands, delegating of UAP, take the verbal order, effective communications, and documentation. When as a RN you will start your job or work, you will face some kind of issues, right? So usually nurses face few challenges in their career, like inadequate staffing or mandatory overtime or safety on the job, and also workplace violence. Whatever it is, during working, we have to work in a disciplined way, and also we work in a team, and we have a team leader. So under a team leader, RN work, other RN will work, LPN can work, MD can work, CNA can work, social worker can work, therapist can work. So the team leader is a RN, right? Or nurse manager. So chain of commands we have to follow. Also, the team leader or RN can delegating the other LPN or UFE to the suitable patient. Also, we taking the verbal order to the patient and other staff member. And if always when they communicate, it should be the effective communication to the patient or to the other staffs. Also, whatever we do, we keep the documentation. Let me talk about more. What is delegation? Delegation, first of all, the RN should never delegate the assessment portion of the nursing process. So RN will not delegate LPN or CNA for any kind of patient assessment. The RN or LPN should never delegate teaching or evaluation phase of the patient care. The RN is ultimately responsible for all tasks delegated to CNA or UAP. Be aware of competence and job description of those to whom you delegate. Also, communicate effectively. The nurse must be sure to follow up on all tasks that were delegated. If criticism is necessary, it should be the private. Means if you do something wrong, the team leader will not make you correct in front of patient. They call you, go to the private areas and then explain. It is very important. Document the unsafe practice and procedure. Manage your time very effectively. Here we are going to figure out what are the rights of delegation. What you have to think when you delegate the other staff for the patient. First of all, tasks, person, communication, and supervision and feedback. Task means can you delegate these tasks? If a patient is unstable, need to assessment or need to check the vital sign, you are not allowed to delegate the CNA go and check the vital sign. Even you are not allowed to assess a unstable patient by LPN, right? So you have to choose what staff supposed to do what. Person, is this person is competent for this patient? Communication, did you give the clear direction? Or supervision or feedback, did you monitor, evaluate, or provide feedbacks? What next? The legal considerations. The nurse-client relationship is a legal status that occurs whenever a nurse renders care to another person. Once this relationship occurs, the law automatically impose the certain legal responsibilities upon the nurse. The nurse should never carry out a provider prescriptions which direct her or him to commit an act which they know or show no is unlawful. Here we're going to focus more about some, uh, ethics and principle, particularly terminology. Here we go, the good Samaritan law. So it act that protect those persons who chose to aid others who are ill or injured from liabilities. It does not cover the gross negligences. So let me tell you one more time. The good Samaritan law was, I mean, protect the individual who help the accident victims from any legal procedure, right? So, like to remove any fear of legal intervention, even payment of fee or police hasslement to, or that times we need to use the good Samaritan laws. Next we go. What is the incidents incidents report? So report usually occurrence and deviations from care standard, facilities used to document, to evaluate the care, determine the potential risks, or discover the system problem that might have contributed to the error. So imagine a patient suddenly fall and you have to keep a documentation. Patient wanted to go to the toilet, during get out from the bed, he or she fall on the floor, right? This is the accident we called incidents. This incidents report you have to keep in documentation for safety of the patient, for safety of your license, right? So never, um, keep this incidents report in the patient chart, also given to manage or given to the risk management. Next here, what is Harrison Narcotic Act? What it is? So Harrison Narcotic Act, basically, the act classifies certain habit forming the drugs as narcotics or begin to regulate them. So this law basically act with some medication that is not safe for the patient or that can cause addiction. It was later replaced by Comprehensive Drug Abuse Prevention and Control Act of 1970. Here we're going to talk advanced directives. What is advanced directives, right? So advanced directives are written instruction recognized under the state of law that are related to provisions of care a person wishes to have when she or he cannot make the decision by themselves. Let me recap it. As I told you, advanced directives, a written statement of a person's wishes regarding the medical treatment, or often including a living will, or made to ensure those wishes are carried out should the person be unable to communicate them to the doctor. An advanced directive, sometimes living wills or durable power of attorney. What is living will? Living will prepared by a competent adult or given the healthcare directives in case when that person is unable to make decision for themselves. So living will basically a written statement where detailing a person's desire regarding their medical treatment in circumstance in which they are no longer able to express informed consent, or especially in advance directives. Next one, durable power of attorney. Also, it is called healthcare proxy. So, documents that specify who will make your healthcare decision if you cannot. So, the general durable power of attorney, a general durable power of attorney, or I said healthcare proxy, is both authorized someone to act in a wide range of legal and business matter and remains in effect. So basically, durable power of attorney we use for healthcare, advanced care medical directives, competent client consult with the healthcare provider and specify the kind of medical care they do or do not want, right, in specific scenarios. In the other hand, it is called living will. So in advance care directives is sometimes called the living will. And the directives is formalized the version of your advanced care plan, right? And advanced care medical directives, it outlines your preferences for your future care along with your belief, values, and goals. Next here, what is HIPAA? It is called Health Insurance Portability and Accountability Act of 1996, shortly called HIPAA. So, the protection, the confidentiality of a patient's healthcare information. It requires physicians, nurses, hospitals, and other healthcare providers to inform the client how their healthcare information is issued and or disclosed. So the Health Insurance Portabilities and Accountability Act, commonly known as HIPAA, is a series of regulatory standards that outline the lawful use and disclosure of protected healthcare informations, right? So HIPAA is a federal law that is required the creations of national standards to protect the sensitive patient health information from being disclosed without the patient's consent or knowledge. Next, organ donation. The healthcare provider determined if the organ is suitable before approaching the family. Here is the few information we are going to discuss about the organ donation, right? Organs should be removed within 1 hour of the client's death, and each hospital has its own protocol regarding organ donation. And donor must be kept on the life support until the organs are removed, and next to kin or closest living relative makes the decision when the client cannot. The next word here, what is utilizations review? So determine the effectiveness of services in a healthcare facility which is related to the client's length of stay. The process compared request for medical services to the treatment guideline that are uh, approved for such a services, right?